Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. The Quad-Demic is creeping up this winter. Here's how to protect yourself. It's that time of year. Temperatures are dropping across the nation, and cold and flu season is ramping up. Respiratory infections like the flu, COVID-19, and RSV cases have been rising rapidly in recent months, according to data from the Centers for Disease Control and Prevention, CDC. /r/n/r/n Unfortunately, norovirus, which causes diarrhea and vomiting, has also been more common this season, with at least 495 outbreaks as of mid-December, about 36% higher than the previous year. /r/n/r/n The spread of these viruses has led some experts to be concerned we're headed for a quad-demic, as case counts for all four of these viral infections continue to rise. /r/n/r/n For the week ending January 3rd, the CDC reports that levels of flu and RSV are very high in the country and on the rise. COVID-19 cases are relatively low but increasing. /r/n/r/n It's common for viruses to surge after the holidays, William Schaffner MD, a professor of infectious disease at Vanderbilt University Medical Center, told Verywell. /r/n/r/n All of that travel and those gatherings, parties, family reunions, being in commercial transport, all of those things accelerate the spread of these respiratory viruses, Schaffner said. Influenza has been moving up, starting in December, and now it's just rocketing. So we're going to have a moderately severe influenza season. /r/n/r/n And it's not just the flu. In the Chicago area, RSV cases are also expected to rise, said Jorge Parada, MD, PhD, the regional medical director of infection prevention and control at Loyola University Medical Center. /r/n/r/n We may not have reached the peak of RSV yet, so it may go higher, but we do not expect it to get out of control, Parada said. /r/n/r/n As for peak flu season, it may be a bit later this year. Flu rates may climb through January. This season typically lasts into March, with peak season being December into January. This year it has not yet peaked, so we expect it to rise, said Parada. /r/n/r/n Flu, COVID-19, and RSV are all more dangerous to older adults and very young children, along with people who are immunocompromised. Early symptoms can be similar, including cough, fever, and chills. /r/n/r/n Instead of causing coughing or sneezing, norovirus results in sudden and violent vomiting and diarrhea. /r/n/r/n Norovirus is extremely contagious and is spread through contaminated surfaces and food. /r/n/r/n This is so contagious, not only is it spread easily person to person, but it can persist in the environment, said Schaffner. That means you can pick up the virus on your fingertips and transfer it to your mouth, and even contaminate food that you or others are about to consume, he added. /r/n/r/n The best way to protect yourself from the flu and COVID is to get vaccinated. This can reduce your chances of getting sick and make it so symptoms are less severe if you do. /r/n/r/n Both seasonal flu and COVID vaccines are recommended for nearly everyone over the age of 6 months. Schaffner said if you haven't gotten your regular flu and COVID shots, now is the time. /r/n/r/n For RSV, the CDC recommends everyone over the age of 75 and people over age 60 with increased risk of severe disease get the vaccine. Pregnant people between 32 and 36 weeks are also able to get the Pfizer RSV vaccine Abrysvo. /r/n/r/n Infants entering their first RSV season are eligible to get an injectable monoclonal antibody. That isn't technically a vaccine but can protect against severe disease. /r/n/r/n Since there is no vaccine to protect against norovirus, your best bet is to wash your hands and clean surfaces to help minimize the risk of catching or spreading disease. /r/n/r/n, and remember, alcohol-based hand sanitizers are not as effective at killing virus particles, said Schaffner, so stick with warm water and soap and washing your hands for at least 20 seconds. /r/n/r/n. Stay up to date on your vaccines and wash your hands regularly to prevent infection. Talk to your doctor if you have difficulty breathing, a fever that lasts more than 5 days, or a young child that appears lethargic or like they have to work to breathe. If you notice signs of dehydration or are unable to keep down liquids, you may need to get intravenous fluids at the hospital.rn/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.